Question 1. A nurse is reviewing discharge instructions for a patient on clopidogrel. What should be included? A. Report any unusual bleeding or bruising. B. Take with aspirin daily. C. Avoid leafy green vegetables. D. Discontinue if headaches occur. Answer. A. Report any unusual bleeding or bruising. Question 2. A nurse is caring for a patient receiving methylorgonavine. Which condition requires immediate attention? A. Vaginal bleeding. B. Hypertension. C. Uterine cramping. D. Diarrhea. Answer. B. Hypertension. Question 3. What should the nurse monitor when administering spironolactone? A. Sodium levels. B. Potassium levels. C. Calcium levels. D. Magnesium levels. Answer. B. Potassium levels. Question 4. A client taking isoniazid is at risk for which deficiency? A. Vitamin B1. B. Vitamin B6. C. Vitamin C. D. Vitamin B12. Answer. B. Vitamin B6. Question 5. Which client statement indicates understanding of nitroglycerin sublingual use? A. I can swallow the tablet with water. B. I'll take it every 30 minutes until pain stops. C. I should sit down when I take it. D. I can take up to 5 tablets in 15 minutes. Answer. C. I should sit down when I take it. Question 6. A nurse receives a new order for 4-lorazepam. What action is most important? A. Push it over 5 seconds. B. Mix with saline and give rapidly. C. Monitor respiratory rate closely. D. Give with antacids. Answer. C. Monitor respiratory rate closely. Question 7. Which medication requires eye exams due to the risk of retinal damage? A. Methotrexate. B. Hydroxychloroquine. C. Allopurinol. D. Prednisone. Answer. B. Hydroxychloroquine. Question 8. What instruction is crucial for a client prescribed omeprazole? A. Take it with every meal. B. Stop taking once symptoms resolve. C. Take it before breakfast daily. D. Crush the capsule for faster action. Answer. C. Take it before breakfast daily. Question 9. What should the nurse monitor in a patient receiving 4-furosemide? A. Hypernatremia. B. Ototoxicity. C. Bradycardia. D. Increased blood pressure. Answer. B. Ototoxicity. Question 10. A patient is taking rifampin. What should the nurse include in teaching? A. Avoid dairy products. B. Report red-colored urine. C. Use backup birth control. D. Expect constipation. Answer. C. Use backup birth control. Question 11. A nurse is preparing to administer phenytoin. What is the most important safety check? A. Administer through small veins. B. Flush with heparin. C. Monitor for bradycardia and hypotension. D. Mix with dextrose solution. Answer. C. Monitor for bradycardia and hypotension. Question 12. A patient is receiving amitriptyline. What is the most serious adverse effect? A. Dry mouth. B. Sedation. C. Suicidal thoughts. D. Constipation. Answer. C. Suicidal thoughts. Question 13. Which symptom is most concerning in a patient taking levetiracetam? A. Drowsiness. B. Loss of appetite. C. Agitation and mood changes. D. Nausea. Answer. C. Agitation and mood changes. Question 14. A patient receives naloxone. What is the nurse's priority action? A. Reassess pain level. B. Offer high-protein meal. C. Monitor respiratory rate. D. Provide oxygen via mask. Answer. C. Monitor respiratory rate. Question 15. A nurse is administering 4 iron. What action prevents complications? A. Inject quickly to reduce pain. B. Use the smallest needle possible. C. Test for hypersensitivity first. D. Administer with dextrose. Answer. C. Test for hypersensitivity first. Question 16. What instruction is essential for a patient taking tetracycline? A. Take with milk. B. Stay out of the sun. C. Crush if too large to swallow. D. Take with iron supplements. Answer. B. Stay out of the sun. Question 17. Which action by the nurse is priority when administering 4 potassium? A. Shake the bag well. B. Administer via 4 push for fast effect. C. Monitor infusion site closely. D. Dilute in 50 milliliters of sterile water. Answer. C. Monitor infusion site closely. Question 18. What is the primary concern when administering sucralfate with other medications? A. It causes dizziness. B. It must be taken with antacids. C. It can interfere with drug absorption. D. It raises blood glucose. Answer. C. It can interfere with drug absorption. Question 19. A client is prescribed metoclopramide. Which side effect is most concerning? A. Dry mouth. B. Drowsiness. C. Diarrhea. D. Tardive dyskinesia. Answer. D. Tardive dyskinesia. Question 20. What finding requires immediate action in a client on enalapril? A. Fatigue. B. Productive cough. C. Swelling of the lips and tongue. D. Muscle cramps. Answer. C. Swelling of the lips and tongue. Question 21. What is the most important teaching for a patient prescribed warfarin? A. Eat more leafy greens. B. Report black or tarry stools. C. Take aspirin with warfarin for better effect. D. You don't need regular blood tests. Answer. B. Report black or tarry stools. Question 22. Which finding in a patient taking carbamazepine requires immediate action? A. Rash. B. Nausea. C. Mild fatigue. D. Blurred vision. Answer. A. Rash. Question 23. A nurse administers glipizide. Which finding requires follow-up? A. Diaphoresis and confusion. B. Blood glucose of 140 milligrams per deciliter. C. Reports of mild headache. D. Occasional dizziness. Answer. A. Diaphoresis and confusion. Question 24. What is a serious adverse effect of vancomycin that requires immediate nursing action? A. Hypertension. B. Chest pain. C. Flushing and hypotension. D. Constipation. Answer. C. Flushing and hypotension. Question 25. Which client report indicates a serious complication of atorvastatin? A. Fatigue. B. Muscle pain. C. Headache. D. Constipation. Answer. B. Muscle pain. Question 26. Which medication should be questioned if ordered for a patient with a penicillin allergy? A. Azithromycin. B. Ceftriaxone. C. Doxycycline. D. Vancomycin. Answer. B. Ceftriaxone. Question 27. What is the nurse's priority when administering doxorubicin? A. Assess for mucositis. B. Monitor cardiac function. C. Administer with food. D. Encourage fluids. Answer. B. Monitor cardiac function. Question 28. A patient is prescribed digoxin. Which finding requires the nurse to hold the dose? A. Apical pulse 62 BPM. B. Potassium 3.1 milliequivalent/L. C. Blood pressure 110/70 mmHg. D. Respiratory rate 18. Answer: B. Potassium 3.1 milliequivalent/L. Question 29. Which patient behavior indicates proper understanding of alendronate administration? A. I'll take it with orange juice. B. I'll lie down right after taking it. C. I'll take it on an empty stomach and remain upright. D. I'll take it before bedtime. Answer: C. I'll take it on an empty stomach and remain upright. Question 30. What is the most important action before starting a patient on linezolid? A. Check recent cholesterol levels. B. Assess for history of seizures. C. Ask about use of SSRIs. D. Evaluate bowel sounds. Answer: C. Ask about use of SSRIs. Question 31. Which client is at highest risk for toxicity with aminoglycoside therapy? A. A 22-year-old with asthma. B. A 40-year-old with hypertension. C. A 30-year-old with liver cirrhosis. D. A 75-year-old with chronic kidney disease. Answer: D. A 75-year-old with chronic kidney disease. Question 32. Which condition is a contraindication for misoprostol use? A. Peptic ulcer disease. B. History of asthma. C. Pregnancy. D. Chronic constipation. Answer: C. Pregnancy. Question 33. What should the nurse teach a patient newly prescribed lithium? A. Avoid all sodium in your diet. B. Stop taking the drug if you gain weight. C. Maintain consistent fluid intake daily. D. You can double a missed dose. Answer: C. Maintain consistent fluid intake daily. Question 34. A nurse receives an order to administer insulin aspart. When should it be given? A. 30 minutes after a meal. B. Without regard to meals. C. Immediately before eating. D. At bedtime. Answer: C. Immediately before eating. Question 35. What is the most important assessment before giving metoprolol? A. Respiratory rate. B. Blood pressure and heart rate. C. Body temperature. D. Pain level. Answer: B. Blood pressure and heart rate. Question 36. Which finding would prompt the nurse to question a new order for metformin? A. Hemoglobin A1C of 8%. B. Recent use of 4-contrast dye. C. Mild dehydration. D. Creatinine of 0.9 milligrams per deciliter. Answer: B. Recent use of 4-contrast dye. Question 37. What teaching is most important for a patient prescribed methotrexate for rheumatoid arthritis? A. Take with aspirin to reduce pain. B. You can drink alcohol in moderation. C. Report any signs of infection. D. Discontinue folic acid. Answer: C. Report any signs of infection. Question 38. A patient on enoxaparin asks about bruising. What is the best nurse response? A. This is expected and not serious. B. Apply heat to reduce bruising. C. Stop taking the medication if bruising occurs. D. Notify the provider if bruising is excessive. Answer: D. Notify the provider if bruising is excessive. Question 39. A patient asks why nalbuphine is not given after long-term opioid use. What is the correct explanation? A. It's less effective in chronic pain. B. It causes addiction. C. It may cause withdrawal symptoms. D. It is only for emergency use. Answer: C. It may cause withdrawal symptoms. Question 40. Which lab value must be reviewed before administering enalapril? A. White blood cell count. B. Potassium level. C. Hematocrit. D. Platelet count. Answer: B. Potassium level. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!